Welcome to Weekly Infusion with Dr. Drew Pinsky and Dr. Bruce Heischober. Weekly Infusion addresses medically related topics. It's in the know, entertaining, and everything you want to know about health and medicine. Now may I present to you the very wonderful Dr. Drew and Dr. Bruce.
Hey, welcome to our Facebook Live viewers. We appreciate you guys joining us for a Weekly Infusion episode. Are we also potting now?
Yeah.
Okay, and our guest, we're very excited, probably our favorite guest, wouldn't you say?
Oh, yes.
Yeah, Nicole Angemi. Nicole, thank you for joining us again.
Hi.
Hey
Greetings.
there. And mostly we like that she makes us look silly, stupid.
She doesn't laugh at my jokes.
She doesn't like your jokes. Then she showed us images that we should know, we don't, and we feel stupid. But that's what's so fun about this.
Yeah.
What are you up to these days?
I just did the Trenton Punk Rocket Flea Market and met some fans, and I'm doing this podcast with you guys right now, so I'm super excited about it.
What? You're doing a podcast with us? What?
Wow.
What are you talking
Yeah,
about?
it's the highlight of my Saturday night evening.
How are your kids?
They're annoying as hell.
How's your husband?
Annoying as hell.
He's even more annoying.
Well, that's about the right scale.
I hate that dude. That dude's, that dude's a jerk.
Oh, come on now. Come on. He's a hero. He's an American hero. He's a fireman.
Yeah, whatever.
So,
He's on my list right now.
okay, he's on your shit list. So yeah, we got to watch our language. We're on Facebook, so they're very particular.
My
with
home
it.
church group's listening. What are we going to...
And then Susan, if anybody on Facebook wants a question, please, please. And same thing with you, Nicole, on your Instagram. Can people ask questions through Instagram? Is that how that works?
Yeah, definitely. I'm on Instagram Live right now, and people are saying hi from all over the world, Ireland. So
Wow.
Ask your questions, and we're going to be talking about mental health along with, I'm sure, like rectal foreign objects will definitely come up in this conversation as it always does.
Yeah, and Nicole, I've noticed now Bruce works in an ER. I've spent time in ERs, and you can't spend more than a few hours there without someone coming in with a rectal foreign body of one type or another. But I have noticed a particular obsession on your Instagram.
Yeah.
That it seems to be not just a recurrent theme, but a very compulsive, ever-present theme.
I'm just like really into it. I'm really into it
Because it's funny? Because what's up with people? Because it's funny or what?
Yeah, I just like to, think about what people, get creative with, and they're sitting around their house, and
I'd like to see
around and say, what can I put up there? And I don't know, it just is very intriguing to me. I love it.
I'd like to see a balance with urethral, vaginal, and rectal foreign bodies, though, Nicole. I'd like you to really get things a little more.
Oh, yeah, she had the beads up there the other day, and those beads got stuck in the bladder, right?
The beads were awesome because the person really thought that they were going to come out in one piece like a necklace, and were surprised that they weren't going to stay together like that. So they were really awesome. I have some other ones. I don't want to just fill my feed with it, so I have just like a folder of rectal bodies that I just, I'm waiting to post.
And you should know, too, I don't know if you experienced this, but everybody that I treated in the ER, and I haven't spent as many years, obviously, as you have, even close, but when in the little time I spent in the ER, every time a foreign body came in, and the explanation was always the same. I sat on it. Always the same. It's just like, what did happen here? I sat on it. It's like, oh, really? This grapefruit? Really? It's like, wow, incredible. But I think these days people are, a little more, forthcoming about their sexual behaviors. And so probably now
some
they
people
actually
are proud of it.
Yeah, right.
Forthcoming.
Right,
It's like,
right.
Look what I got up there.
Look what I did.
We had somebody that
Look what I can do.
Was molding, that was working with plaster and trying to put something up there that was, and it was rapid setting.
Oh, no, cement. Send that to Nicole. Why didn't you send those to Nicole?
Oh, my God.
Okay,
HIPAA.
let's keep this
HIPAA.
PG.
Okay,
and move
let's
on.
All right.
PG.
So, Nicole, I'm closing my eyes right now because I had what's called a radial keratotomy, or a PRK, on Thursday, where it's sort of like I couldn't get LASIK because I have too thin of a cornea, so they have to do a full PRK. Thank you, Dr. Aseel. They did an amazing job. Did it in about 11 minutes. But they take off your cornea, laser the inside of it, and then put a lens on top so the cornea grows back over that guide, essentially. But today is my super pain day, so I am like in a lot of pain. So if I close my eyes, I apologize to Facebook and I apologize to you, Nicole. But it comes in these waves where I'm just So
he's refusing to take narcotics.
That doesn't sound fun, but hopefully. So you're supposed to be able to see without glasses after
I
this?
I actually can see without glasses even right now, better than I have since I was in fourth grade. I've been driving without.
Really?
Yeah, but it waxes and wanes and changes because as the cornea grows back, first of all the cells that are proliferating create a little bit of a blurriness, and then when they come together, they create a seam that's like looking through sort of water. And I've got that going on in my right eye right now, and pain. So. Good times. The only time I experienced anything like this, I was telling Bruce, 20 years ago, I was swimming in his pool in Redlands, and I swear to God, a bee stung me in my eyeball. I'm glad you find that amusing, Nicole. That's all I can tell you.
Well,
we're going to get along fine.
Adam Carolla finds that amusing. He loves that.
I thought you should have wore sunglasses or something.
I was in the pool. No. I was in the water, and it literally paralyzed me. Where I thought I'm going to drown.
It was an ant, a red ant, or a fire ant.
Maybe something like that. It felt like a bee sting, but the whole globe.
I thought Drew was having a myocardial infarction. Actually,
so I'm like,
did anyone take a photo of this?
This is 20 years ago. No documentary.
Well, Susan, my kids found a photo of you sitting in the jacuzzi. Oh, really? Yes.
From back then. All right, so the day
You're
has
more
been,
beautiful now than you were.
The day has been...
Yeah, it looks
that's not
pretty
possible.
mom-gene-ish then.
The day has been memorialized. So what's coming up on Facebook or on Instagram? Anybody have any questions or anything? Susan?
Or comments? Don't read the comments.
They're just, we just have to have an hour about things... people stick up their rear end. I mean, people are obsessed with the topic, but we have to move on today because we already have a planned topic.
Yes. We also have some stump the docs thing. She's going to stump us thoroughly like she always does. But back to the rectal stuff real quick. It's not a laughing matter because people rupture their colons and they can and that is a very difficult area to get through, particularly in an emergency.
Yeah.
Surgically. I mean, if you get a colon, the through and through colon tear, or you rupture the wall of the colon, that's peritonitis, that's bleeding, that can be dead in a few minutes, really.
Right.
And so, have you seen that? I've seen that.
Absolutely. Yeah. And the other thing is, once a foreign body's up there, then you get spasm, and many times, even if you don't need surgery, you have to go to the surgical suite to get general anesthesia just to get the thing out. And Bezors up there, down there.
Oh, I saw your Bezors. Those are nice.
So the advice that we have to give is that you should order sex toys online. They come discreetly delivered to your home, and they're made so they don't get stuck up there, although they still can get stuck up there.
Yes, they can.
Do you have a product line, Nicole?
Sounds like she's coming up with one.
Not yet, but it's in the works.
Safe sex products by
Nicole Angemi.
Yeah, you know what?
That's
something that we will be working on in the future. So if anyone wants to contact us, we will be happy to give our 2 cents about that.
We can Susan. We can team her up with Ken. We'll work on that for
Emily Morse.
Yeah, sex that way. But okay, so you want to talk about mental health? Let's get into that. Go ahead.
Yeah, I really think that I want to talk about it because I'm pretty nuts myself, and I like to talk lightly about it because I have been diagnosed with mental illness since I've been a teenager. So I think that I could kind of joke around about it because I've had some serious issues my whole life, and I think it's something I want to talk about because it's something that's been in the news a lot lately, and it's something that it seems as if it's the central problem to all of our problems, and it's not really talked about enough.
Yes, ma'am. Yes, ma'am.
So maybe you want to start talking about something, and I could kind of chime in.
Well, we have you and I talked about Chester and Chris Cornell and stuff. I don't think you and I have
off
done
the
that.
record. Speculation.
I mean, these are right. I mean, these are people we knew well, and so the topic of suicide. I apologize, my eyes are going crazy again, so I'm going to put on glasses, which is going to be bizarre to my viewers, but there we go. But they told me the radio I look cooler this way. So,
you look super cool.
Thank you.
Intimidating presence, with or without the.
I can just see it with my eyes closed now. So suicidality is sort of the opiate thing is one thing that is obviously a hot topic. People, if you want to know about that, so go to me and Bob on the This Life podcast. We talk about it all the time. The suicide has been a big topic, obviously.
What's a TV show or? adolescence and suicide.
13 Reasons Why.
Right. And
did you watch 13 Reasons Why?
So I didn't watch that, and I don't know if I really want to watch it. I think that suicide is a super touchy subject for me because it's something I've been struggling with my whole life. Mm-hmm. So I'm not really sure. I mean, I don't know if I really need to watch it or want to watch it, but maybe I will.
It's a well done show. I'm not into censorship. I don't think they should be censored. There is concern about what it has generated. And I think the biggest problem with it is that it sort of it reinforced adolescent fantasies about suicide. Maybe you could address this if you had suicidality as a teenager, because teenagers seem to think like as though suicide becomes like a way of ending pain, so you can go to heaven and then look down on everybody that maybe get some retribution. This magical thinking. And in 13 Reasons Why, this girl leaves this tape behind where she's having retribution in very complex ways by these people listening to these tapes, as though she were there watching all this. And that's really where it gets to be a problem. But Nicole, I'll have you comment.
I mean, I think that these are very real feelings that you get, and you know that they start coming in heavily as a teenager. Mm-hmm. I mean, I got them, and I still struggle with having those feelings to this day, even though I'm medicated, you know? Mm-hmm. And I think that it's just a lot of the problem is that it's just kind of not cool to talk about, I guess. You know, there's a stigma attached with it.
With the stigma, with the suicidality or the depression? Which are
just
both.
The depression.
Yeah,
but I think a huge problem with it is that, for example, in my case, is that when I first started having the issues when I was a teenager, it was just getting treated by a family doctor and going to a psychiatrist and them just thinking that I had depression and putting me on Prozac and then not being followed up by psychiatry, and just not ever being able to kind of stay in the mental health system because it's so horrible. So I didn't get diagnosed with bipolar depression until I was older, like 25.
Did you see Sinead O'Connor's video?
No.
It really was. I recommend it. It was very appropriate, I thought, about how much stigma she's had to suffer, that anyone with mental illness suffers, how common it is, how it is the problem of our time. And she was expressing deep empathy, speaking of the crappy system. Here she is, somebody with tremendous resources, and yet she suffers and is in pain. She can just imagine how much miserable it is for people that don't even have resources and have to sort of...
Yeah, I mean, I was like that. I was in school to get my master's degree. I was working at a hospital, and here I was like buying illegal drugs. I was buying Xanax, taking them every day I wasn't taking them to get high. I wasn't getting high. I was just taking them because I couldn't deal with the amount of anxiety I was having and the thoughts I was having. Yeah. I just, you know what I mean?
Yep.
And I finally was able to get help, but I couldn't, I mean, to this day, if I want to go see a psychiatrist, like let's say I just want to go see a psychiatrist, I can't get an appointment for 6 months. And you know what I mean? Things, and it's so ridiculous. And this is just my particular case. I have very good health insurance. I live in America.
There's a national shortage of psychiatrists.
There's the shortage of psychiatrists. Yeah, absolutely. And though but it's in the context of what Nicole was saying earlier, which is, this is the thing that's killing young people right now. This is it. This is the problem of our time, and she can't get an appointment for 6 months, which is insane.
And I feel like I'm very self-aware of my mental issues, and I'm basically begging for help, and I can't get it. So I imagine the people that are not really as open to it, that are trying to get help. And also, I think that I don't know. I just think the whole entire system. I wrote a post about it the other day, basically saying like, you have your brain, and if you have an aneurysm or you have a brain tumor, you could call and get an appointment next week to get brain scans and everything like that. But then if you're talking about psychiatric disease, it's not even. You have to call this number on the back of your card. That's like a completely different system to get treatment, and they kind of treat you like you go to some weird clinic and stand in line. They told me, they said, come in on Monday and stay in line. You stand in line and we might be able to see you.
Wow. They also treat the doctors that way too, trust me, which is the other, I get to go on both sides. I don't know if you've had this. Well, you're in the Kaiser system, so it's different. But when you're, calling as a physician, reviewing on behalf of a patient for psychiatric care, you are treated like crap. Like abusively. And so there will never be...
And as a patient, you're standing there in line with a bunch of other people in line, and you're just kind of like, okay, what's this person here for? What's this person here for? And it's just really awkward and uncomfortable, and you don't, you know what I mean? The whole system is just really, really upsetting to me.
What kind of response are you getting from your listeners or followers?
Like right this minute, or
once you started posting some of the mental health issues?
I think that a lot of people feel the same way. A lot of people are writing comments saying that they're having similar experiences, and I just see, like, when there's the mass shootings and then people, especially people, I 100% understand why people start doing heroin and stuff. It's like you just when instead, if they were just getting proper treatment and taking SSRIs and antipsychotics and everything, and making these feelings go away with the proper medication and therapy, they wouldn't be looking for drugs to get normal. You know what I mean?
Right. And the opiates, people gravitate to those typically when they have trauma. Did you have trauma growing up yourself?
No, I didn't. I'm screwed up. Like, I have an extensive family history of mental disease on both sides.
Bipolar.
Actually, one of my grandmom's sister killed herself with bipolar. I have it in my family.
And it tends to be a very, biological genetic disorder. And the good news is highly responsive to medication. Are you?
Yeah, and it's a constant struggle that I deal with, but it's, you know what I mean? It is manageable on medication. You know what I mean? It's just like you have to take it and you have to do it and you just have to stay on top of it. You know what I mean?
Yeah.
Well, I think one of the other issues, not only is it's difficult to get in sometimes as a formal mental health system, but there are other support groups and
you mean like 12-step kind of thing?
Yeah, 12-step or for adolescents, through school or church groups, or because one of the issues that comes up for me, patients come in and the younger they are, or if they have a substance abuse history, they expect immediate results. If they're started on an antidepressant or other medication, if they take it for a few days and there's not an immediate response, then this isn't working, and they also, there's a judgment psychiatrists don't do anything; they just pass out pills. And in some systems, I think it's important to be seeing a therapist and understanding. Most psychiatrists don't do talk therapy. They don't do the cognitive behavioral therapy. They don't do groups. So that understanding how the medical system works and what are realistic expectations out of the medications and what a psychiatrist does.
Well,
I definitely think it's a combination thing, and family practitioners are handing things out. I think there's a time and a place for that. If a person's having an acute event and they need a couple, there's people that have like what I call like normal people that are just have pretty much normal, psyches, and then someone, maybe their friend dies or their husband dies, and they might need something to get them over the hump for a little bit. That's appropriate, but there's other people that need to seek further treatment, and our system is just too messed up now, and I think it's the central core to a lot of our social problems.
Although
I completely agree.
On the other hand,
homelessness,
about 75-85%, I think, of antidepressants are prescribed by family practitioners, and I think training today, I think people in most cases going to a family practitioner is a viable way to get help.
It's the only way they can do it.
Right, but
it's the only way they can, and they and the family practitioners are not trained to do this, and they might even see a family practitioner. They might see a nurse practitioner, right, and unless you have psychiatric training.
But in most systems, they're okay. And and I've been in several systems, they're telling patients do not expect to see a psychiatrist unless you have resistant depression, bipolar depression, most depression I don't think is...
Well, but Nicole's got bipolar depression. She's telling you she can't get seen, right? It's hard.
Right.
And this is what my one family doctor kind of saved my life, because I went to this new family doctor, and I was just telling him, I'm on this, I was on Lexapro at the time.
It'll make it worse.
Just was like, I'm having so much anxiety. I just can't, I just was like, I'm so, and then these anxieties would lead to like massive depressive episodes, massive, to the point where like, I would spiral out of control and be like, the only way that I can make this go away is if I just end it, I just need to end it.
Are you on a mood stabilizer now?
Yeah.
Yeah.
And
sure.
that's what,
so does it.
You know that if you're on SSRIs, you just push like manic episodes.
Yep.
Get worse, right.
Yep.
But what I'm saying is
and your bipolars are more likely to kill themselves in their manias than in their depressions.
Exactly.
Right.
So he said that to me. He was like, you know what? Like, I don't feel comfortable putting you on these. You need to see somebody because like I could push you in the wrong way. You know what I mean?
Right. Absolutely.
Right. I mean, my feeling is I think the family practice training programs today are much better at preparing family practitioners for recognizing what they can treat and what they can't treat.
Okay, fair enough.
That's what I'm saying. So, and people out there that are feeling like I can't talk to my primary care physician about how I'm feeling.
Oh, you can.
You
For
can,
sure you can.
And it's much better than it used to be. I mean, and just so anyway.
But
and that's why I want to talk about my own because I feel like I want to talk about my own experience because I'm able, I was able to go through college and do all this kind of stuff under a tremendous amount of stress. I have children and everything, but I just want people to know that you could like live a normal life and because I think that a lot of people think that when you're bipolar, it's like you're really like happy one second, really mean the next second, and it's not like that at all. I just think that it's just not. I think that what people think it is, it's not.
Right.
And I think that if regular people talk about like what they have, then a lot of people will feel more comfortable talking about what they have. You know what I mean?
Yes.
Well,
yes.
And one of my concerns are with all the marijuana laws being liberalized, that a lot of these people are self-medicating bipolar and other mental health disorders with pot, and the more pot that's out there, and it's not an effective way to do it. So.
The only thing it is effective for is the chronic pain more than the opiates.
Right.
So,
no, absolutely.
Yeah.
For the record.
I mean, I'll be honest with you. Like I feel like I still self-medicate a lot with marijuana. Like I'm honest with you. Like
but it's not your primary mood stabilizer.
Yeah, you have to be careful.
Yeah.
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 Yeah, but I mean, I think that for me, that's like an easy. I do because I have so much trouble with getting what I feel is like proper treatment that I would like to get.
The way you'd want
if I have control over it.
Right.
Right, but those people that are out there that are listening that smoke pot every single day and they're highly functional, a lot of those people, if they'd stop smoking the pot, they'd probably have an accurate diagnosis of what's going on because they probably have a mood disorder.
After they go through withdrawal.
Right, after they go through withdrawal.
So, Susan, anything from Facebook?
Let's see. Not really. I mean, nobody's really
just admirers.
No, they're just listening,
comments.
and they're not a lot of like somebody said. Is it safe to take Zola long term for anxiety and depression? Can this do any damage?
Well, it doesn't do damage, but I have seen people get Zoloft withdrawal after being on it for a long time.
But it's probably the safest.
Yeah, it's safe. It's not going to harm you, but it can cause an unpleasant sort of withdrawal syndrome sometimes.
But what I tell patients, it's no matter what medicine you take, if it has an effect, when you stop it gradually. And gabapentin I have so many people on gabapentin. It's a great medication, but don't stop it suddenly.
Yeah.
Blood pressure medicine.
So I'm having a lot of people say that, and I have heard this a lot on my Instagram too, that when they go to get mental health treatment, that they're being told that, and I also experienced this one time when I went to a group session at my psychiatry office, that they're being told that their problem is almost like not bad enough, that they don't need to see the psychiatrist, and they're being told that they just should go to their family doctor to be prescribed something.
That's what Bruce was talking about.
That's the model, though.
Yeah, that is the model now. And you're not, and no one is in trouble enough to need therapy, according to this model, which is a travesty, because every bit of research I know shows that the medicine with the talk is what's necessary, right, to get the best outcome.
Right. But I just know in our medical system there's a lot of outpatient groups, and it's easy to get into a therapist. It's harder to get into a psychiatrist.
Oh, is that right?
And when you order a referral to a psychiatrist in our system, you're questioned whether or not you've done some of the basic screening and medication. But anyway, so it's...
Here's one. Emma Chase. Has she considered using RAP, Wellness Recovery Action Plan, and DBT skills?
So, DBT is either a group or individual dialectical behavioral therapy. Have you ever had anything like that, DBT?
I don't even know what that is.
Yeah, it takes, that's, again, you have not seen a therapist, right? Or you do see a therapist?
Me?
Yeah.
Yeah, I have in the past.
But nothing recently?
I have recently, within the past 6 months, I have, yeah.
Okay, but not an ongoing relationship with the therapist.
No, not really.
Okay.
It's I just feel like it's always some kind of a system error. It really is. It's just there's always this place. It's just like system problems.
In your life?
Insurance, I mean, my insurance place is just so ridiculous. They give you a list of phone numbers and then you call. We're not taking new patients. This, that. It's just so crazy. It's so crazy. It actually gives me more anxiety looking for a doctor than just to not look for a doctor.
Well, and of course that's their model, right? If they don't have to render services, the mission accomplished.
Yeah.
I mean.
In California, there are fines for lack of access. Access is a big issue here, and again, different systems have different time frames for that. But I don't know if you have an insurance commission there. Complaining is worth it, but it makes a huge difference here.
The Department of Mental Health here has picked up a little bit of the slack too.
Right. Oh yeah.
It didn't used to be that way. Trust me. Do you have a Department of Mental Health locally there, or a county system, anything like that?
It's a possibility. I'm not sure. I was just going through the insurance, and then I even was working with a local crisis center at one point, who was the most helpful at this point.
They're often
it's actually a new thing that they're starting around here. It's almost like urgent care for mental health.
Huh. That's interesting.
It's pretty cool because it's one step above going to the hospital to admit yourself into
right.
the hospital.
It's like a crisis stabilization unit.
Yeah, it was pretty cool. So I really like that place.
Maybe they could refer you to some services as an outpatient. It seems like they should be connected.
Yeah. And I mean, it's cool because if you're having a freak out, they basically chill you out and get you all situated. But, they only could take care of you for 10 days or something, and then they push you off to somebody, and then you kind of fall through the cracks again.
Well,
it's just how it is. You know what I mean? It's hard.
Susan, you have something?
So I have one more question. Is it possible for someone to have CTE if they did have a bad injury or stroke?
If they didn't have it?
If they did.
They did.
My father exhibiting signs of dementia, but I think it could be more like CTE than dementia.
Well, I mean, dementia.
65 years old.
Dementia very common.
Been on opioids and benzodiazepines.
No, the CT is not something you start thinking about when somebody gets dementia.
So we should take a break and come back and do the mystery.
Okay, we will do that. But let me say it again. I misspoke. CTE obviously is something. It's common. It's probably more common than we realized. But when somebody has a dementia,
what is CTE?
A chronic traumatic encephalopathy. Okay. It's what we're seeing from the NFL.
Right.
But it's not, when somebody gets dementia, which is a common thing, you're not immediately first thinking of obscure causes. That's all.
Somebody here said there's a peer support group on Facebook.
I'm sure there are. That's another way to do it on social media. Have you tried that, Nicole?
No, I've never. This is the first time I'm actually talking about it.
You're gonna have a lot of people reaching out. Trust me, because it's so common, and there so many people feel just the way you feel. All right, we'll take a little break. Be right back. Hydrolite, of course, you've heard me rave about these guys. It's a product that I actually wanted to develop myself. I conceived of this. I knew it was needed. It was already in Australia, and now it is here. It works. The feedback is unanimous. Even though it's great to use, though, when you're sick or dehydrated, you can use it every day, especially now that the weather is changing. It's hot. So whether you're exercising or maybe you got seasonal allergies or you drank too much or you got vomiting or diarrhea, whatever it might be, you can reduce fatigue and keep feeling healthy as well. Once you've started feeling dehydrated, sometimes a little too late. So you want to stay hydrated. And rapid rehydration, if you do get dehydrated, requires a proper balance of sodium, glucose, and water. And nothing provides it like Hydrolite. I'm telling you, it's the same as an IV fluid via your mouth, via your enteral system. It's based on established, proven science, quite simply the best rehydration product out there. It comes in great flavors. They have those fizzy tablets. Also, they have a powder and a premixed drink. Compared to other sports drinks, Hydrolite delivers up to 4 times the electrolytes with 75% less sugar. Hydrolite solutions are appropriate for all ages, and each bottle or package includes easy-to-follow directions. All right, you can find Hydrolite at Rite Aid or online at Amazon or click through at drdrew.com. And for a limited time, our listeners save 30% on Hydrolite if you use the code DRDREW, Dr. Drew, HY at checkout. That is DRDREWHY. 30% off. Great deal. Do it. Well, one of the great parts about working in recovery is seeing former patients successfully move on. And I've had patients that have come up to me years later and shake my hand and say, you know what, sometimes people are kicked out of treatment. And many of these folks move on to become mental health professionals themselves. And, of course, the field of psychology is vast. The need for competent practitioners is huge. If you're considering this rewarding career, I urge you to consider the California School of Professional Psychology at Alliant University. Now, I've known them for a long time at Alliant University. I've spoken at their past events. It was founded in 1969. It's boasts an alumni network of nearly 50,000 people worldwide. And Alliant has fostered many of today's mental health pioneers, authors, and advocates. CSPP at Alliant University hosts both on-ground and online programs in business psychology, marriage and family therapy, clinical counseling. They also offer APA-accredited doctoral programs in clinical psychology that can allow for specialization in child psychology, clinical forensic psychology, and integrated psychology. And the faculty is crazy. It's made up of leaders and historical figures like Abraham Maslow, Carl Rogers, Viktor Frankl, some of the true fathers of modern psychology. For more information, and I worked alongside of these students as well, by the way, in the clinical setting, as well as having lectured at the institution. So for more on the California School of Professional Psychology, CSPP, at Alliant, click the Alliant banner on our website or visit Alliant, ALLIANT.edu, alliant.edu. We're back, and Nicole's gonna make us really embarrass us.
Tear down our egos.
This is image number 5271.
Is that right, Nicole? Are you still with us?
Yeah.
Okay.
Okay. So this looks like to me, it looks like skin, and it's kind of polka dotty red stuff.
If I know
all
it's
over
Nicole,
the
it's probably a
place.
foreskin, but let's.
I love Susan's gross description.
Yes. Okay, so we're gonna. Do we need to see it? Show it to the Facebook crowd?
No, it's
All right,
on.
so
They can see.
it's on there.
For weekly Infusion followers.
Nicole, does this give you?
I feel like we did this one before.
No.
But
No.
But
I think you did.
We did.
did we not?
I think we did,
We
Nicole.
might.
So
Michelle, did we do?
We definitely.
Okay, don't.
I think we did.
Pretend they didn't.
We did.
How about
You're
that?
making us feel even stupider.
I'm sorry. I'm just pointing out that you guys
Nicole-
have already
and
seen
for
this
my
once.
followers-
The question is, have we done it on Facebook Live? No, we have not.
No.
No, and for my followers, I will post all these tonight.
Yeah, so tell all your followers to go to Facebook Live and watch you there, and turn off your Instagram feed.
It's got a smooth surface, right?
Well, I'm just trying to.
Oh,
don't
okay.
know
You
what
want me
that-
to turn off the Instagram?
Yeah, and tell them to go over to Facebook Live.
This strange.
All right, guys.
Hang on, don't tell us. We're trying to figure. We can't even figure out the
Wait,
anatomy.
I'm going to tell them though.
Okay, go ahead.
Erythema multiforme.
But I'm not
No.
sure it's skin.
Guys, book live.
Oh, okay.
Is it skin? I mean, look at this sort of.
Wait, they're saying no, they don't have Facebook.
Oh,
What is that?
well, they'll have to listen to the
All right,
podcast later.
I'm not sure if that's a.
They can stay with us on Instagram. It's fine.
Okay,
I'm
fine.
going to put
It's fine.
And I'm gonna post these on, and you guys are gonna post them on your Facebook too, right?
Yeah.
On the website.
We'll
On the
we'll
website.
post them.
We'll
All
put
right,
it at
we're not
doctor.com.
gonna go any-
Put it at doctor.com.
Is it?
Can we, if we could nail
I'll
down,
post them. I'll post them.
can you nail down
not
for
gonna
us?
do
Looks like a
Facebook.
shoulder to
Figure it
me.
out.
Can you tell us where this came from, at least?
I'll post these after I'm done the
meningococcal
earlier.
meningitis with diffuse hemorrhage,
Yeah, it could be something like that. Is this skin we're looking at?
or skull skin.
Just because your wife said it was skin doesn't mean it's skin.
I know. That's what I'm trying to figure out. These crescent-shaped things.
I know you're wearing sunglasses.
Oh,
Yeah,
Get a
take this
candy
one.
cat.
Nicole, your dominatrix on the side. Like
Look at this.
striations, yes, vascular.
But it may not be
It's
skin.
not, may not be.
I mean, it could be some.
Oh, it's a big ovary.
Yeah, it could be an ovary or a big gallbladder or something. Or
A testicle.
No.
Hot or cold, Nicole? Come on. You're enjoying
I
this.
mean, you're in the right body.
Oh, really?
You mean a human? Is that what you mean?
You're in a human.
God. Is this so politically correct you can't give us a sex hint? Male, female, Zed?
It's gross, whatever it is.
It's
You
not-
guys had this before.
No, we
I don't
didn't.
think
I'm
we did.
embarrassed.
How dare you?
I'm embarrassed.
I think you did.
100%.
Michelle, didn't
Yes.
we do this one before?
100%.
Oh,
I'm s-
God.
We did. I told Susan we already did it. The first time you guys ever
Then
did
give it
this.
to us.
I'm
Let's
going
hear
to
it.
medicate you, Michelle.
Screw
I know we did because this is like a really good case.
All right. Maybe present the case to us. See if we can figure out what you've got here.
It's infarcted
This
tissue.
person is in their 50s, and it's a woman, and she presented really sick, like almost dying.
Septic.
Yeah.
And in fact, she died because this is from her autopsy.
Thank you.
And she was on a camping trip and then came to the hospital like really, really sick and died. She was married and she had 2 older boys and
Fulminant Lyme disease.
some question if she possibly ate something on this camping trip, but that's about no significant medical history.
So can any of the Facebook people guess what it is?
Yeah, anybody could guess.
Yersinia. Want to give us a Susan?
I'm not getting it.
It's not brucellosis or one of the.
All right, well,
Uh-oh.
it can't So Bruce said something about the brain, right?
Yeah.
The meningitis.
Yeah.
Yeah, it's a
So
So-
fulminant-
diffuse hemorrhagic something or other.
Yeah. fulminant
That's somebody
meningitis.
said that's a rash. That's what I thought.
So it can't be brain because there's no wrinkles.
Right. There's no brain tissue.
Skull.
Oh, yeah.
And it's
Oh, I wonder if
kind
the-
of too shiny for
Is
skin.
it the calvaria?
No.
It's a dura mater, pia mater.
Yeah.
Somebody said DIC.
All right, let me
Diffuse
All right, so-
intravascular
so let me
coagulation.
tell you what organ it is.
Yeah.
It's the liver.
Oh. Okay.
It's the Glissen's capsule of the liver.
Okay.
Glissen's capsule.
It's like the outer surface of the liver.
Do I have the sound on?
So it's some sort of fulminant hepatic necrosis, right?
Yes.
Yeah.
Very good.
So. Okay.
So this is an acute process that
Hepatitis
started
A.
from
Something.
Did we lose her?
Do we
I mean,
lose?
it's super rare. It's not like I'm not thinking that you should know this.
I mean, it could be if it's an ingestion. I mean, there's all kinds of stuff
So
that can do this.
she was camping. It's an
No, I'm just saying. I mean, I'm
Infection.
not saying that it is an ingestion. I'm just saying that there was a thought that there could have been an
Yeah.
ingestion.
Fulminant hepatic necrosis from something camping at a lake. Is that what you said?
No.
Yeah.
Yeah. I cannot think of any bug bites or
amoebic,
infections.
fungal, anemic, some sort of.
Somebody said conclusion, grisly way to die.
Yeah.
Yeah, for sure. Fulminant hepatic necrosis is not good. Well, what do you got? Hepatitis A?
All right. So
Fulminant hepatitis
okay,
A?
so when we did the autopsy on this, we didn't know what it was either. All we saw was this liver, and we were like, "What the hell?" I mean, obviously this is the cause of death, but nobody knows what happened.
Yeah.
So under the microscope, a couple, days later, it was herpes.
Oh.
Herpes.
Systemic.
You remember now?
No, we never saw that.
No, because I've never seen anything.
Yes, you.
I've seen herpes encephalitis, but never this.
Yes, we did systemic herpes.
Okay.
Well, it was a long time ago. So we thought this would be an interesting topic today.
But so here's, let me tell you why herpes is coming up. The Usher deal, right? He's getting sued for not telling somebody he has herpes. And clearly there's a ethical...
Is that something you have to tell someone?
Ethically,
Should I tell my husband last night that I have?
you better tell him. You better tell him. Quickly, get to it.
I didn't know that was like a law.
It's a law and it's an ethical thing. But I went out and I said, look, I got involved in radio because I was frustrated with people making such a big deal out of herpes, which is essentially a skin rash in the vast, vast, vast majority of cases. And there was this really serious thing coming, HIV and AIDS, we now call it.
Right.
And I said, you need to know the difference. I mean, herpes is a nuisance, and it's unpleasant sometimes, and there can be weird complications like this, which none of us have ever seen. I almost wonder if it doesn't even make sense. But
yeah.
Immunosuppressor.
Yeah,
the woman
right.
filing the suit didn't have any sequelae from the explosion.
Didn't even get herpes, but she had distress.
Yeah, but what bothers me is the misconceptions that promotes is people that have had herpes and that are on they're on medication or they're not in the midst of an attack can be infectious. It's not a leprosy. It's
a skin rash, and I said that, and people are freaking out about it, Nicole. So although we're looking at a terrible complication, and there is such a thing as herpes encephalitis, 1 out of 6 people have this thing. It's very common. It's mostly just a nuisance.
Same as a mouth cold sore.
Same thing, just in a different place.
Right. And Nicole, I hope you feel good about yourself now that you've
stumped us, humiliated us. But do you want to add to what I'm saying about the herpes?
Yeah, I think that in this case, this woman, I mean, this is a woman that's been married for 25 years. She had, I mean, not that this means anything, but she had like full, pubic hair. She didn't know, she probably didn't know she had it. She probably presented with urinary tract infection symptoms and went to the doctor and complained of having pain upon urination and stuff like that. If she went to her family doctor and had those complaints, she probably got medication for it. Maybe, sometimes when you have the original outbreak, and sometimes patients just don't have symptoms that are that bad. So, if the doctor's not actually all up in there checking, nobody's going to know that you even have it.
Right.
And this is just a freak
complication,
rare complication. And she showed up to the hospital with this.
I almost wonder, is there any possibility that whatever antibiotic they gave her really is what caused the liver problems? You know what I mean? I mean, that's more likely to happen. Much more likely than herpes doing this.
Yeah, it's kind of a thing that there's more to this story. This isn't like a normal thing that would happen. And you kind of have to wonder, well, she probably fell in the range of obesity, she probably had the BMI, just borderline, like a 32, you know what I mean?
Yep.
But you can see her liver's like a little fatty, it's a little yellow, and that right there could just be enough to a little bit of liver damage or something like that, but it's not common. I think that,
But listen, we've been talking about stigma and mental illness. This is another disease that's highly stigmatized. Was my point. That's why I was saying it's just a skin rash. That's not.
She didn't know she had it.
Most people don't even know they have it.
Yeah.
And so, what do we do with the stigma on this one? Then, when people are diagnosed, they want to kill themselves. We're seeing that now.
We have an email from somebody too. It's
to
in that file of paper, and he said, "Thank you so much for bringing this up because of that." I'll find the email.
Okay.
It's over here somewhere.
But have you seen, Nicole? Have you heard about that? People getting so upset about it?
Yeah, I think it's the same thing because we've seen it with especially really bad cases of HPV where you get a lot of genital warts and things like that. I don't know. I just think it's all kind of ridiculous.
Right.
But I could see, I guess, where people are freaking out about it. I don't know.
I get that it's not fun, it's not pleasant, and it's, but in the spectrum of the kinds of infectious diseases you can get, resistant gonorrhea and syphilis now are going to be a thing soon, and people don't even contemplate those diseases.
And here's a thank you to you, Dr. Drew. You were on TMZ?
Yeah,
very good.
Yesterday.
Okay. Oh, saw a clip of you on TMZ talking about herpes, and I wanted to thank you. I was one of those you mentioned that was suicidal when I found out 2 years ago, and I still have a hard time dealing with it. Wow. From the stigma perspective, even though I haven't had an outbreak in 6 months, and it doesn't bother me physically.
And here's Nicole. Here's the comedy. I was talking to the lawyer who's executing this suit, and I said, Lisa, what's the end game here? Let's say he told her, and they broke up, and she's pissed off and said he didn't tell me, and now it's his word against hers. Are you saying the only way we can really do this is to get paperwork, have documents, signing the risk and benefit and the understanding of what you're getting into? And she said yes, that we're there, that we're.
I mean, if you have, it's just like a stupid argument. It's just like trying to sue someone for getting pregnant or anything. And even if you wear a condom, I mean, just bumping against that area, you could get anything. There's no such thing as having safe sex, and you know that. You know what I mean?
Yes,
so
not
the
100%.
whole argument is stupid.
Not 100%. Just bumping against that area. I want to make note of that.
I think significant.
Just bumping against that
significantly,
area.
this guy is mentioning there are a lot of Facebook groups out there for people for support, and it helps. And in the groups, it's been discussed that we want or need someone in the celebrity community to fight for us and to educate the public. Thank you so much.
Well, I got horrible. What's his name?
Kenny?
Just Kenny. Not Kenny. Kenny, I got horrible pushback on Twitter. People are like, oh, it's just a skin rash. Turn back your MD. I'm like, what are you talking about?
Oh, my God.
Who are you people? Where is their physician training from?
You have to have a thick skin, huh, Drew?
I guess so. Anyway, let's see the next picture.
Okay. Hold on one second.
The only time that
actually, it's
herpes
right in front
is really
of
a big deal is if you're immunosuppressed,
right,
or
pregnant.
You see, the thing that it's an issue is if a mother has an outbreak when she's given birth and then passes it on to the newborn, but they always give prophylactic Valtrex.
Yes.
At 36
That's
weeks,
right.
so they can't pass it on like that.
That's right. So it's not as big a deal as it used to be during pregnancy, even. And
they just give it, even if the mom's not having an outbreak. If you have a history of ever having an outbreak, they give it at 36 weeks, and then so you don't pass it on to the baby.
Yep. All right, here comes something. What the hell?
You're gonna have to take your glasses off.
Is that a C and B?
Ectopic pregnancy.
Oh, it does look like that a little bit. Let me see.
What?
Hold on. Let me see it. We're looking at a pretty.
There it is.
Oh.
Like it's about.
I know Michelle knows what this is.
Oh, it's a mushroom.
This looks more like testy, but
yeah,
okay.
Testicle.
But what's here?
It's a.
It looks like something Rex would really enjoy.
Oh.
You want to give us any?
Rectal prolapse.
Yeah.
Oh God.
I'm looking at Nicole.
Actually, I think Susan is kind of mostly on the ball with this one.
What did she say?
About the dog.
The dog would like it.
Yeah.
Meaning it's a bone.
No, I mean it's stool.
It looks like a bone to me.
Oh, I see. We're talking about with Mary Roach.
Is it a sarcoma?
I don't know. Anybody on Facebook think they can figure it out?
Clavicular sarcoma or something? Crazy like that?
You're getting warm, Drew.
Rib.
Is that like a rib? Or a met?
A rib?
What kind of cancers grow in the ribs?
Osteosarcomas? Mets?
Oh.
What else?
You're getting warm.
Bruce, help me. That's all I've ever seen on the ribs.
Yeah.
Osteosarcoma.
Oh,
Right,
lung
so
cancer metastasis.
Osteosarcomas are more common in the
pelvis and femur.
Yeah, femur.
They're more common in the appendages, right?
Yep.
And what kind of are more common in like the pelvis and the ribs?
Metastatic, prostate.
No, that's not a metastatic.
What kind arise from the cartilage?
I was going to say, this looks like a benign,
Somebody says testicle tumor.
chondroma, almost a chondroma rather than a chondrosarcoma.
Chondrosarcoma.
There we go.
Oh.
Okay. Chondrosarcoma. Good times.
Good times.
So how am I supposed to know that?
I got to
Nicole?
see if I can find the other one.
It's all right. She's letting us use our. Yeah, she's letting us use our deduction. She's letting us use deduction.
So this is a pretty crazy resection. Are we going to describe it real quick?
The chondrosarcoma? Is this the new thing now we're looking at?
Yes.
Okay.
All right, I'll describe it on the Instagram.
Wait.
Basically what we were looking at was a tumor that was growing out of a section of the rib cage.
I think we've lost our audience.
I'll write it up on my Instagram for you guys.
Okay, now this is a mess.
Compartment syndrome after surgery?
Something like that. Well, are we deciding it's an arm? Is that where? Or is it an arm or is it like a leg?
Drew, my husband is writing a comment and that he's hungry for dinner.
Somebody guessed spleen.
That's
on
not
Facebook.
that is not a spleen.
Tell him to. This is why I'm saying he's on my list this week.
I will
man.
tell
He's
him
somebody
that your wife said peanut butter and jelly and bread downstairs.
There's a frozen peanut butter and jelly sandwich in the
there you
freezer.
go.
He could have. All right.
Well, hold on here. Hold on. We got to figure this one out.
This is a really good one. This pertains to our topic of mental health issues and such.
Uh-oh.
Self-inflicted gunshot wound.
Of what?
I don't know.
Mental
Let's
health.
say more on the drug abuse lines.
Oh, okay.
So
this was a giant abscess or something, or some necrotic something from being injected?
No, so this is actually interesting. So this was a girl who is obese, and she was overdosed on opioid pills.
Oh.
And she passed out on top of her arm.
Yeah.
Oh.
And ended up getting compartment syndrome.
Well, that's what Bruce said. Bruce said compartment syndrome first.
Right
first
off
thing.
the bat.
First thing.
Come on, Nicole.
So there you go. Why does that look like compartment syndrome to you?
I don't know. Just
because they had to split it open.
It makes me a great doctor.
Yes, indeed. Just your instinct.
He's like, I just know. So her arm became necrotic, and they had to open her up like that.
What are we looking at in that dark thing in the middle? I can't
so
figure
her,
what that is.
I guess
unless it's a
for
vein.
the people looking, they're not really going to be able to see. I'll post these photos online, and these are, I guess the last two photos are from people sent them to me, and I'll tag them in the photos. But this is from someone sent me this photo. The muscle is actually necrotic or dead. So muscle in an arm of a human should just look like steak. It should look like healthy steak you would buy at the grocery store. And it looks, you see how it's kind of like gray?
Yeah.
It has like a grayish.
Sure.
So that means it's dead.
Yeah.
But this looks like a surgical field, so this is not a dead patient, right?
This person's alive still. She was
they
brought
got
in.
sterile gloves on, so this is after they
opened her up.
Yeah. So it looked different if it was dead person post compartments.
Would not look so red.
Yeah.
We were talking about rhabdomyolysis on a previous show, an upcoming show actually, where after you have a compression like this, you can get the muscle released into the bloodstream and shut your kidneys down.
You're right. I bet you've seen some people that died that lived quite a while with some sort of compartment or pressure. We're talking about people who have been under a pile of rubble and then pulled out after days, and then afterwards they get the toxicity from the broken down muscle and die. But they may have.
I've seen it before.
Is there another picture? Or is this?
Are we done?
Oh,
is
it's
that
a threesome. Nicole.
Oh.
Well,
I have to say something.
We are properly humbled, Nicole.
Yeah, right.
Bruce, I think, guessing compartment syndrome got the one and only time out of every time we've ever done this, the correct answer. I just want to point that out. I don't think you guys have ever gotten.
I think
one
I got.
before.
I think I got gallstones or something once, or kidney
All right,
stone. Or
maybe.
So,
Michelle.
I'm sorry. I'm keeping
it's all right.
score.
It's all right.
Score.
I want to be stumped. That's how you learn. Failure teaches.
True.
Right, Nicole?
Yep.
Thank you. All right, so we need to wrap this up so you can go take care of your charge, meaning your husband.
So, Nicole, is it going to disappoint your fans that there's 2 old white guy doctors with no tattoos out here?
How dare you?
We're definitely gonna get one for you guys.
Wow.
That's gonna be like a thing we're gonna do, and we're gonna film it.
How about a black light tattoo, where they can't see it unless I put a black light on it?
We could do that, but I don't know if you want to like inject that stuff in your skin.
I have an aversion to needles. Susan, not injecting anything.
Susan wants to get it. You can get her one. She wants to get a certain something. So
yeah. So one of your Facebook guys said, John, he goes, I had a fasciotomy from heroin overdose.
Fasciotomy.
And compartment syndrome, and whole leg looks worse than that. But can't send you a guy.
Yeah, he probably had a compartment though from.
Tell him to email it to me, and I'll post it.
Yeah. Email it to her. What's your email?
So fasciotomy is what we're looking at. That's what they were doing there.
iHeartAutopsy@gmail.
iHeartAutopsy@gmail.
Yeah. So what we were surgically looking at was a fasciotomy, which is what this gentleman had. I wonder if his compartment syndrome was just from injecting to abscess or God knows what. Or
yeah, I get tons of pictures like that sent to me from the abscess cavity from injecting.
Yeah. So it's a big deal.
It's really sad.
It's
Skin
a big
poppers.
Deal. Yeah. It's not always just the crocodile that does that. Just regular old injecting can do that to you. And certainly cocaine and speedballing for sure can create a mess. So. Well, Nicole, what else should we do before we wrap this thing up? Did we get everything you wanted to get out mental health-wise?
Don't be depressed.
Did we crap on your husband sufficiently?
No, we can never crap on him enough.
The 3 of you, Michelle, my wife, you ought to get together. It would really be a party, crapping on husbands.
Totally.
And everybody's making fun of your glasses, but sort of in a nice way.
Let me. I'll take them off for a few minutes. But I actually had to have my eye. I have what's called blepharospasm. I can't keep my eyes open very long, and the light bothers him. So
should he keep his glasses or get rid of his glasses?
Oh, that's the other thing. Susan wants me to not wear glasses at all under any circumstances. I can't. I can't keep my eyes open.
So everybody, just leave your message. We're going to get going.
This is no.
Everyone is totally commenting on your eyeglasses, and someone said that your Stevie Wonder glasses are epic.
So this is with glasses. This is without glasses.
I don't know. See, I have massive anxiety about not wearing.
Yeah, I'm that way. I'm that way too.
I would never get surgery.
Yeah, I'm that way too a little bit. But it's nice to have the option. And this is Stevie Wonder.
And we want to thank Hydrolite and Alliant University for sponsoring our podcast and our Facebook page. And go to drdrew.com for all the podcasts that Dr. Drew has to offer. And
thanks, Nicole. Really, it's always a privilege to talk to you and spending time with us. And thank your husband for letting you run away for a little while. We really appreciate it.
Everybody likes the glasses.
Well.
Okay.
I can't deal with that. Bye, everybody.
Okay.
Remember, you can find all these podcasts at drdrew.com. The Dr. Drew podcast, the This Life podcast with Dr. Drew and Bob Forrest, and the Adam and Drew podcast, which is available 5 days a week. Find them all on iTunes and rate us 5 stars. Subscribe and get it first. And if you're really happy, click on the Amazon banner at drdrew.com to help support the show. We'll thank you for it. If you join the email list via drdrew.com/contact, we'll send you a weekly Infusion newsletter with Dr. Drew's news. We're so grateful when you get in touch. We read all your emails and we'll bring you the subject matter you want to hear about.